ensure that hospitals that serve low-income people are in Tier 1. The State Assembly Regulatory Oversight Committee Chair is Assemblyman Reed Gusciora. Thanks for being with us. What is your major concern with Horizon's Omnia healthcare plan?
Well, New Jersey requires that healthcare plans be adequate and also in the public interest. The Omnia plan is neither, especially for urban hospitals. In the city of Trenton, both hospitals arbitrarily were deemed Tier 2 by Horizon, and it excludes cardiac care, trauma, and maternity care. There's no other tiered hospitals in the county that cover those services.
So what's the fear, that this would force those hospitals that are in Tier 2 out of business?
Yes, I think in effect Horizon has gone to select hospitals without telling anyone else. We will pay you less reimbursements, but we are going to send you more customers because we're going to in effect put out of business anyone that's a Tier 2 or lower hospital.
Let's talk about your set of bills that has passed through committee. How would they require hospitals to disclose, or what would they require hospitals to disclose?
Well, we require Horizon to disclose their criteria, how they selected the hospitals in Tier 1 or Tier 2 categories. In the city of Trenton, you have a hospital, St. Francis, who has gotten quality assurance awards, but yet Horizon itself has left it at the cutting floor.
So these stipulations retroactively apply to the current Omnia plan, not just future tiered networks?
Well, I think it puts all the hospitals on an even playing field, and it requires that insurance plans disclose how they select the hospitals, and then after that, consumers can make their choices of which plans they're going to pick. It's cynical that Horizon advertised the Omnia plan without disclosing to persons, especially in urban areas, that they would not have accessible health care in their midst.
So let me ask you that again. So you would require the current Omnia plan to make these disclosures?
Yes, and I think that's fair, and that's in the public interest, and it's also something that the Department of Banking and Insurance should be ensuring that these health plans are adequate. The Christie administration has been largely asleep at the switch and allowing Horizon to make public health care policy without any oversight by the state.
One of these bills is aimed at making sure low-income patients are adequately served. Is there evidence that Horizon's Omnia plan really won't cover it?
To this day, they won't. If you have an Omnia plan in the city of Trenton or a state worker, and you have cardiac care issues or trauma issues or even maternity issues, you have to go outside the county to get Tier 1 services.
Should health care be decided by health insurance companies as opposed to doctors?
Absolutely not. I think that the Department of Banking and Insurance should take a more active role. Are there too many hospitals in the state? Probably. Should efforts be made to consolidate them? Yes. But should the insurance company themselves make those decisions, or should the state step in? I would rather have the state do that.
Do these bills have enough momentum to actually get to the governor's office desk and get signed into law?
Well, it brings public awareness as to the pitfalls of having a plan like Omnia. But in the meantime, we're going to be pushing the legislation, and we hope that Horizon does the right thing in the meantime and open up their doors for inspection, so to speak, so that people know how they selected these plans.
Okay, Mr. Chairman, thank you for being with us.
Thank you, Mary Alice.